Well, hello and welcome to Is It Burnout or Is It Depression webinar. In case we haven't met, my name is Holly Foxworth. I'm a registered nurse and the content manager for marketing here at Axiom, and I'm joined by our Senior Vice President of Behavioral Health, Dr. Les Kertay. I'll let you meet him momentarily. But as you guys know, this is a very sensitive month and it's really important throughout the nation. We had, with it being National Suicide Awareness Month, we obviously recognize the sensitivity that goes along with that, and know that these are some really difficult decisions and discussions that are taking place. But we also know that starting that dialogue and opening up some of the open and honest communication and really normalizing this discussion of workplace mental health is the first step in moving in the right direction. So we appreciate your not only making this a priority, we appreciate you attending the last webinar that we had where it was the suicidal tunnel vision. You guys asked so many questions. We were so blown away really with the number of questions that you asked. They were excellent. We got to some of them there, and then those that we didn't get, we ended up putting together a live stream to circle back and those up. So if you missed either one of those two events, you're welcome to view those on demand. You go to our YouTube channel, the Axiom Medical YouTube channel, and you can always review those there, or you can share them with somebody else that may benefit from those as well. So thank you again for that, and we appreciate your attendance. I do have some really exciting announcements to tell you about. So not only do we have this that's going on today, but next week, our Axiom team is going to be at the National Safety Conference, the Congress and Expo there. And so that will be in San Diego. If you are already planning on attending, we hope that you'll stop by our booth and say hello. If you would like to go and don't have tickets to the expo and would like some free tickets, we've sent out some emails for those where you could register it and attend. If you didn't get that email, please send us a note and we'll happily send you the information so that you can do so. The next event that we're going to be having is actually, it's called Devastating Impact of Quiet and Calculated Workplace Cultures. We've heard a lot about this coined phrase of quiet quitting or quiet firing, passive aggressive, etc. So this can be more of a like a fireside chat where we're going to ask the hard questions and really have some honest conversations about how you can get to the next level of where we need to be as a nation from a workplace perspective. So we hope that you'll attend that. If you'd like to attend, obviously at the top, as usual, it's there located on your screen, top right-hand side. You'll just press the register now button. That'll get you registered. You get the email link, and there's nothing else that you have to fill out. So we hope that you'll do that. And then the last thing, I'll just kind of spill the beans here. I don't think we put anything out about it formally, but we are going to be having a summit on November the 3rd. So we did this. It was our first one last year. We're going to repeat that again this year. It's a half-day event. And so the title of that is All the Right Moves. And so we're going to be bringing in a lot of the concepts that go along with not only mental health, but also psychological safety, et cetera. So be in tune, be alert for the information that will come. You're going to love the speakers that we have lined out for that. And we are excited, and I think that you'll be excited to attend that as well. So that's kind of a lot of announcements for me. I've done more talking in the beginning here, less than what I normally do. I will tell you, though, that at the bottom, that's that resource section. You can have a copy of the slides if you need those for any reason. There's also some information about some of the blogs that go along with some of the mental health concepts that we will discuss, and white papers on and on. Last thing I will say is that, as you did before, we don't have to mention names specifically. If you have any questions whatsoever throughout our entire event, we like for this to be very conversational, back and forth. We don't have to say your name. And so we will kind of keep that to a minimum there. And then also, just as a reminder, when we get to our poll questions, those are anonymous. We don't put those out to anybody else. So please feel free to give us your honest opinion of what's placed there. Dr. Les, how about you? Tell us about yourself.
Well, it's great to be here, Holly. Thanks. And for those who might not know me, I'm Dr. Les Kertay. I'm a clinical psychologist. Have 45-ish years of clinical experience and about 20 years in mostly corporate settings in occupational health and workplace mental health. And I came to Axiom as Senior VP for Behavioral Health to help the team really focus on bringing behavioral health into what Axiom already does well, which is injury case management. And so building out those programs. And it's great to be here.
I love it. I love it. Well, we love Dr. Les Kertay, and I think we've decided he's America's doctor, basically, at this point. So he's the newer version of Dr. Phil is what we'll call him for sure.
Oh,
All
dear.
right. Yeah, I'm telling you, it's that good, that good. Well, before we get started with this, what I did want to do is kind of push out this survey here, this poll, and you can let us know what your level of burnout would be. So would that be not me? I'm walking on sunshine. I have no burnout issues whatsoever, no problems in my life. Would it be, I feel a little bit overwhelmed at times and it can feel like it's starting to take a toll on me? Or the last answer would be, I'm more, if one more, can you do this or that, away from saying that I quit. So within that range, there's 3 answers, and we hope you'll put your answer there, and then we'll go through some of those towards the end of the presentation. Let's see. Hopefully that stays up. If it doesn't, let me know, and we can pull it back. So in terms of what we'll go through today, we're going to talk about the burnout and depression. We're also going to talk about recognizing what the signs will be and how it is that you can tell the difference. We'll specifically look at who's your at-risk population there, what that effective management would look like, and then also talk about how it is that you can support your workforce through that. So the first thing I wanted to do to kind of get started, I like stories. They resonate with me, and I'm sure that they help you guys as well. But there was one story that I came across, and it was a lady by Alice. And so she was talking about her experience of burnout and kind of what she went through. And so I wanted to share that with you. She said, in March of 2020, I caught COVID-19. The company I worked for sent everybody home indefinitely. And then by June, that they started laying employees off. She said that she had to take on the role of 3 laid off employees on top of what she already did. Then by September, they'd made the decision to permanently stay at home. The office lease had expired, and she was the only one that had a car that could drive there. So then she was also tasked with being the one that goes to the office and unloads, or I guess you'd say pack that office up completely alone. And then the last piece of that, which made so much sense to me, she said, on top of dealing with all of the stress, the anxiety, and the emotions of having a year-long COVID illness, I'm trying to juggle 5 roles at work, along with all of my personal responsibilities. And the last sentence that she said there was, I'm past burnout. I'm charred, dried out chicken cutlet left in the skillet overnight.
Wow.
Those are words.
What a visual.
What a visual. That's exactly right. Yeah. So talk us through kind of some of those symptoms and you know what we would be looking for, because it does seem like that there's a difference there between the two.
Mm-hmm. Absolutely. You know, I think that one of if there is a positive thing about COVID-19, about the pandemic, it's that we are talking a lot more about behavioral health in general and stress in the workplace. Yeah. I think it's really important to have those conversations. If there's, you know, a downside to that conversation is that we tend to throw both of these words, burnout and depression, around kind of loosely. And so I think this is a great opportunity to really talk about those 2 things and, you know, what is that exactly? What are those 2 things? And they do have overlapping symptoms. You know, being tired, low energy, disturbed sleep, having a hard time getting focused, staying focused, and irritability all can take place either in a depressive disorder or a depressive episode, or in burnout. So there's reason that we get confused by the 2, right? That overlap is pretty significant, but there are also some really important difference.
Yeah, for sure. Well, talk us through burnout then. We'll start there since we started that with the survey.
Yeah. So I mean, I won't read the whole slide here, but a lot of, kind of uh, the the key triad in burnout is it really results from unmanaged long-term stress in the workplace. And what we see is people who are exhausted, both emotionally and
Yeah.
physically. This notion of cynicism, kind of being negative, feeling cynical, feeling negative, often is a really important part of burnout that we see. Um, and then this sense uh, of uh, I'm sorry, reduced productivity at work, right? The
Yeah.
inability to either, I mean, we see both, and I'd still potentially call it burnout. We see people who are getting things done, but it's really inefficient,
Yeah.
So some of us have had the experience of getting to that place in a particular job or a particular setting, and we're getting it done, but we're working until midnight, which of course then just makes everything worse.
Yeah.
So, that exhaustion, poor performance, and cynicism is kind of the triad that's really the tip off. I do think it's worth saying here that I think we've also gotten somewhat loose about the word burnout. And sometimes we use that word like I'm really burned out, when what we really mean is I'm stressed. I got a lot
Good
going on,
point.
right? And and that's
Mhm.
not and I think unfortunately some of the discussion that we see online, some of the surveys, some of the polling that we see, even some of the publications about it, they conflate those things. This is not just stress. This is someone who's hit the end of their rope, um, and or is headed that direction really fast. And ideally, we want to stop it before it gets to that point.
Mhm.
Because one of the
Mhm.
things that happens, you get to the point of being burned out, and it's really tough to break that cycle without getting a good break and getting some significant support.
Yeah, definitely. Whenever you talk about the inefficiencies, do you feel like that's related to, just kind of like your brain function? You're not able to, you don't have the rest, or you don't have the ability to kind of think as clearly as what you would if um, you were eating right, you were taking care of yourself, and you had a little
Right.
bit more time to think through things? Would that be where that
Sure.
would come into play? Or what? Yeah.
Sure. I think it's fatigue. I
Hmm.
also think that, um, for those of the people who are in the audience who have children, teenagers particularly, they all tell you that they can multitask. I do my homework better when I have headphones on. Um, human brains do not multitask. We're usually pretty efficient at being able to switch from one thing to another and going back and forth. When those changes start to happen too fast and there's too many things to um, to focus on, what happens is that we get distracted because we're bouncing really fast from one thing to another, and that makes us horribly inefficient. And I think that's what we're seeing people who are distracted. It's
Hmm.
like distracted driving, or only it's distracted living, right? Um, you're checking your phone every 5 seconds. Um, those kinds of things, and if you think about what's been going on during especially the early part of the pandemic, we had an unknown disease with potentially dire consequences while we were suddenly working from home and taking care of kids who are having to do school. Uh, that by itself is just a huge burden.
Yeah.
And then we saw a lot of what was described in that story, where companies had to downsize their workforce, but there's still a certain amount of work that needs to get done. So fewer people are doing more. And that's just a prescription for this to begin to happen.
Absolutely. So when we look at then who it is, then that would maybe kind of be high risk for being subjected to this type of condition. What would you say that would be? The remote work and those that feel isolated?
Specifically remote work that makes us feel isolated. So I've talked about this quite a bit. I've been working remotely for quite a number of years. But the first thing that I learned, initially when I was working remotely, I was managing a team that was also remote. And one of the things that I learned was that I had to work really hard to make sure that I stayed connected to other people on the team, and that I made opportunities for people to connect with one another. Remote work doesn't lend itself easily to what we used to call water cooler talk. You just drop by somebody's office, and so it can be really isolating. And what we have to do is be really conscious of connecting. That feeling of isolation, I think, is the risk factor. It's not remote work per se. It's that feeling of isolation. Certainly, the other things on this list are risk factors. Being worried about our jobs. Who wasn't worried about our jobs for the last couple of years? Working excessive hours. One of the downsides of, the positive side of working from home is you get to work the hours that you need to work in order to get your job done. The downside of working from home is work expands to fill the time allotted for it. And so, we just keep working because it's easy to do that. And, there are strategies to help with that, but that's one of the things that we have to watch for. Any job that has unclear expectations gets a lot more unclear when it's remote.
Oh, good point.
Right? If I don't know what my job is that I need to get done, and I'm sitting at home, I'm very prone to being distracted. And then, of course, I feel behind, and I get frustrated, and I get scared. All of that begins to happen. And sometimes a company's response to that is micromanagement, which is almost always a prescription for burnout. No one likes to be micromanaged. We do like to understand what the expectations are, and we like feedback about how we're doing. But nobody likes to be micromanaged. I actually used to tell my staff that. It's like, if I have to micromanage you, neither of us will be happy.
That's very true. Very
right.
true. Yeah, that's exactly right. Yeah.
So, I think all of those things make us prone to risk. You should note that all of these things are stressors that are risk factors for a great many things. But it's that chronic stress that isn't being managed that eventually leads to burnout. So, which is different than depression when we start to talk about that.
Absolutely. One of the things we talked about the kids, the kids being at home whenever we had to do that, make that initial transition. But we also, it feels like that we have a lot of aging parents now that we're also taking responsibility for.
That's a great point.
How does that play into this?
Well, it's one more stressor. It's one more thing to occupy space in our mind. That our ability to switch sets, to go from one thing to another, is not unlimited. Right? We're usually pretty good at it. And some of us are really, really good at going back and forth between two things. None of us are good at going back and forth between 15 things.
Very true.
So the more things that you pile on, the worse that begins to get. And most of us are really conscientious about our our work and we want to do a good job. And when all that is going on and you're not really doing the job that you know you could, that actually really then I think contributes to the stress and ultimately potentially contributes to burnout.
Yeah, definitely. Yeah. Let's see. I think we had some questions that were asking.
Sure.
Let's see. Chrissy is asking, can burnout lead to depression and can you be both? Yeah, I think we'll get to that momentarily. Let's see. We also had one that was asking about, can we share the link? I'm not sure which link that is. If you could send us a message and just clarify that, that would be great. I'm thinking maybe you were meaning the link towards the NSA, but definitely if you'll give us that additional information, we can follow up with you. All right, so on to depression here, because this one gets a little different here. What makes it different?
I think so. I mean, first off, when we even need to make a finer grained distinction, because there are feelings of depression. Almost everyone from time to time has a day when we feel kind of blue. We're not ourselves. We don't have a lot of motivation or energy. It's kind of hard to get motivated and get moving. Pretty much everybody has that feeling. So feelings of depression are one thing. Having a depressive episode or a depressive disorder is something else again. And it's not, one of the things that's hard to have about this conversation is I think we confuse the two. And it's like, well, we see somebody who says they're feeling depressed and we think, well, yeah, sure, I feel like that too. Well, if it's a major depressive disorder and someone is having an episode in which they feel, for up to 2 weeks, feel really low mood, poor motivation, hard to concentrate, we're not talking now about someone who just has a hard time getting out of bed. We may be talking about somebody who literally is unable to get out of bed.
Right. Yeah.
So a depressive disorder is a diagnosable and clinical condition that either really needs or at least will respond to good quality care. And that is, and I think that's the most important thing to distinguish. Burnout really needs a kind of a different response than depression. Taking a break is not going to make depression better, a depressive disorder, right? It's not going to fix that. Might help to get some perspective, but that by itself is not enough. The key differences between burnout and depression really center on this notion of it's the duration and the depth of the feeling, and also when we start to look at hopelessness and guilt. In cognitive behavioral therapy, we call it the cognitive triad: negative views of ourselves, the world, and the future.
Wow.
When that starts to happen, that's something that we begin to really pay attention to. Sometimes, especially interestingly, especially in men, depression will actually manifest as irritability and not really low mood. So it doesn't have to look like what we would expect. We've come to expect that a person with a depressive disorder will look sad all the time or be tearful all the time. Sometimes it's really irritability, but we see that in combination with these other features. Negative view of self, so feeling a lack of self-worth. Certainly thoughts of death or suicide, suicidal ideation is something that we always pay attention to, and especially if it's combined with some of these other symptoms. So I think what we're trying to do here is paint a picture between, one of these things is chronic stress that's poorly managed. The other is a clinical condition. Let me answer that question about can burnout lead to depression. Burnout can lead to feelings of depression. And in a
Mm-hmm.
person who either has a recurrent depressive disorder or is prone to it, burnout can trigger that. It's not going to cause it directly in the normal sense. Like if you don't have a disposition towards it or you haven't had it in the past, burnout's going to cause something else. You're going to have a lot of stress responses and you may have feelings. You may have bad days, but it's not going to
Mm-hmm.
cause a major depressive disorder. But it can trigger one in someone who's prone to it. So I hope that answers that question.
Yeah, yeah. We had several other questions that came in. One was, let's see, it said, I'm the poster child for this topic, both burnout and depression. What is happening when you feel like that you're shutting down in a particularly difficult environment? Let's see, my screen is going away. Particularly different event or issue, like something is happening in the brain or emotion that you can't control. It's frightening to wonder if the real self is broken and will never come back. Does this make sense? Great question.
Yeah. Well, I think that I really want to like underline that part of that question, that that feeling of fear, like am I losing it and will I never come back? I think that can happen in both. I think that can happen in a depressive disorder and it can happen in burnout. I'm much more worried about it in a depressive disorder. Because often burnout, even really, really severe burnout, can benefit from taking a break, sharing a workload. Sometimes people end up quitting their jobs because they just can't take it anymore.
Yeah.
And typically it does tend to change. A depressive disorder doesn't necessarily change when you do that. So someone who's prone to both, it can really get confusing. And, my advice is that, part of treating the depressive disorder is going to be, okay, let's also figure out what we can do about that level of stress. While I'm there, I think it's helpful to say that I think that we all, we have a terrible problem with mental health stigma. We also have we have stigma around stress and burnout, and we kind of those of us who have not experienced it in particular have a tendency to think that it's somebody else's weakness. It can also be truly unrealistic demands. One person can't do 5 people's jobs, right? That's not a problem with the person who's got 5 people's jobs. That's a problem with having 5 different people's jobs,
Right.
if that makes sense, right? And I think that we have to acknowledge that this isn't only about individuals. It's about it can be about the workplace, and we need to address both of those things.
Yeah, definitely. Yeah. Let's see. I think we had a few more that had came in as well. One was asking what makes someone more prone to having a depressive disorder, and we can get into that here on the next slide here as well.
Sure.
If you want to go ahead and kind of pivot onto that, yeah.
Sure. I mean, these are all known risk factors. So if we see these, we know that there's some risk for it. So having a mental health history personally, so having had a depressive episode previously, or a serious anxiety disorder, that's a risk factor. It's not a guarantee that somebody's going to have a depressive disorder or a depressive episode again, but it's something to pay attention to. Family history is also something that we look at. That's partly genetic, we think, but it's also partly, if one of our parents is really severely depressed, we learn that way of relating to the world. And so part of it's learning and part of it's genetic. we think. But for sure, it's partly learning. But having that mental health history in the family is something. In someone who has those risk factors, um, a sudden life changes, big life changes, grief, job loss, relationship loss, can trigger an episode. And I'm very deliberately, and when we were talking about doing this, I that was one of the things that I said to you. I'm using that language really deliberately. Grief does not cause depression, but grief can trigger a depressive episode. And so getting support for grief can really help avoid a depressive episode. Same thing with burnout. Job stress can trigger an episode, and it's a risk factor for an episode, but taking care of that stress is something that can help us avoid that depressive episode. Substance use and particularly depressive substances is a risk factor that we know about. Serious physical illness, and probably the biggest risk factor is lack of social support. We're back to that isolation issue. Feeling unsupported, feeling disconnected is a huge risk factor for a depressive episode. Again, none of these by themselves make somebody depressed, but they're all risk factors that we look for.
Yeah. While we're on this, I'm sorry to put you on the spot. I know we kind of didn't talk through this, but with it coming up several times. So when we talk about that support and talking about how it is that you could reach out either on your own or somebody reaching out to you to close that gap so that you're not feeling so isolated and lonely, what would that look like? What would practical ways of that, what would that be?
Well, as hard as it is, I'm going to make this sound simpler than it actually is when you're in this state of mind. But finding anyone to whom you can talk and say, you know what, I am not doing so well. That could be a spouse. It could be another family member. It could be a friend. It could be a pastor. If nothing else feels like it's available, the suicide and crisis prevention hotline, which now you can get with 3 digits, 988. Finding someone to whom you can simply say, I'm not doing well. People who have heard me talk before, and I know you've heard this, when I reach out to somebody else, probably, I've often said the 4 most important words are, how are you doing? And probably from the person who's experiencing this, the most important words are, I'm not doing well.
Yeah.
I'm having a hard time. Any version of that. And it's really interesting. And if you think back to a time when you felt particularly badly, there's almost kind of a magic to owning that with someone else who doesn't discount it or, it's like, oh, I got that out and it wasn't the end of the world.
Yeah.
Right? That's how you get social support. Now, I'll say one more thing about that, which is that it's important to pick who you say that with, because what you don't want is you don't want to say that to somebody who is going to dismiss it or immediately try to fix it. Most of the time when we're really struggling, we don't want to get fixed. We already know all the stuff we should be doing. What we need is to just be heard. It's important to be choosy in that way. Um,
Yeah.
but those are things that I think are really important. And certainly
Mhm.
self-care things that feel good. I used to tell people, you know, if you're feeling really, really badly emotionally, it's important to eat by texture, right? There's nothing wrong with comfort food. Sometimes that, I mean, a diet of Twinkies is not a good idea. If having a Twinkie reminds you of your childhood and it feels good, having one is probably okay.
I love
Um,
it. I love
y-
it.
you know, I mean, you can make better choices too. If okay, and, and ice cream would feel great right now. It'd be really comforting, but I don't want to do that because it's not healthy. Having a carrot is not going to satisfy that. Having pasta might. Right? That's what I mean by eating by
Yeah,
texture. You
yeah,
know,
yeah.
having noodles with butter might take the place of that, of the ice cream. Having a carrot's not going to get it done.
There you go. Folks, you heard it here. The doctor said you have we're writing it out. This is your prescription. You've got your free pass there. Yeah. I love it. I love it. I
Have a
love it.
Twinkie.
There
Yeah,
you go.
I'm
Have a
sure I'll be
Twinkie.
famous for
Yeah.
that.
There you go. Twinkie. Twinkie Kertay. There you go. All right. So when we're looking at these differences, I know we've kind of talked through some of them, but just to kind of summarize this and really kind of put some time frames around what that would look like. Tell us a little bit more detail, but then we've got quite a few questions that have also came in as
Yeah,
well that we'd want to get
yeah.
to about management and
And I
support.
really
Okay.
appreciate people getting involved in it. Yeah. Um,
Yes.
um, so some of the key differences, and if people can read this slide, burnout clearly has an identifiable cause. There's an intolerable or what feels like an intolerable work space, um, or work set of tasks, right?
Mhm.
A depressive episode may or may not have what we think of as an identifiable cause. Because remember what I've said, those causes are triggers, not the underlying cause. So, um, if it's got an identifiable cause that you can do something about, the place to start is to do something about that cause.
Mhm.
Typically, burnout develops over time. A depressive episode might come on slowly, but often comes out of nowhere.
Mhm.
Um, Combinations of significant stressors are common in burnout, um, and there's really, there aren't criteria around duration. To call it a major depressive episode, we, you know, we look for a minimum duration of 2 weeks of this kind of really difficult mood. And granted, you can be burned out and toughing it out, and that can go on for more than 2 weeks. But so that by itself is not the determinant. But if you
Right.
start to put these things together, you begin to paint two different pictures of conditions, and it's important because they need two different solutions.
Yeah. Makes a lot of sense. Yeah. Whenever you say, whenever you talked about the combination of things, so whenever you made that reference, are you referring to maybe job stress? You've got a lot that you're taking on at work, and then in addition to maybe what you have with your kids, and then maybe if you have caregivers, or you've got financial pressures, or things of that sort. So is that what you're referring to then in the
Mhm.
combination? Okay.
Yep,
All right. Good.
yep,
Yeah.
yep.
And then
Yeah,
the
it's
other
usually
piece I
not
was going
just
to,
one thing.
yeah,
Well, one
yeah.
thing can cause us stress. One thing probably isn't going to, by itself, isn't probably going to lead to burnout to that level of cynicism, exhaustion, cynicism, and difficulty with productivity. One stressor is probably not going to lead to that kind of triad.
Mm-hmm. Mm-hmm. And then the other thing I was going to ask you about was the reference to a chemical imbalance. So what could you give us some more details about that? Like what do you
Well,
mean? Is there what would be going
it's
on in the brain
interesting.
that would be imbalance?
Yeah, I mean, we've had we have long had a hypothesis that serotonin in the brain, levels of the chemical serotonin, which controls the speed at which neurons interact, certain sets of neurons interact. So that's what neurotransmitters do. Serotonin is one of those that we thought for a really long time was connected to depression, and we've taken medication. We've done medication trials to try to address that. There's recently been publication of a huge kind of umbrella study that indicates that we're not so sure about that. But I will also say this, nothing happens in our minds that isn't happening in the brain, right? It's not like mental disorders it's not like mental disorders aren't real because they're not physical, and physical disorders are real because they're physical. Like, you've never had a thought, a feeling, a plan, an experience, a sensation that didn't have an underlying physiological component. It never happens. So it's reasonable to understand. The way we've said it is mental health is health.
That's
and I
right.
mean that absolutely literally, that there is the distinction between a mental disorder and a physical disorder is a false conception. It may or may not be a specific chemical imbalance of serotonin, but we can be assured that our brains, in the midst of a depressive episode, our brains are not working the same way as somebody who's not having that experience. So that may be like way more than you wanted, but
no, but I think it's said a lot, and I think that the big takeaway there was the piece about mental health is health. That just says it all. Yeah. Well, let's talk about effective management. Then we'll go through some of the poll results, and then take the questions, and then wrap up with the best practices. So tell us. I think we've gone through some of these already, but I do think there's a difference here in the approach on how it is that we could take care of both conditions.
I mean, first thing is address the stressor. If there's a clear set of stressors, get support. Figure out how to address those stressors. And I would say that in both of these, if you're really, really stressed and it's a depressive episode, addressing the stressor is still a good idea. Right. Often depression will not, just by removing the stressor, will not improve. Right. In fact, one of the discouraging things is, well, I took care of that stressor, but I still feel bad. That's really scary. Like, it's not getting better. I don't know. Seeking support by talking with others, I think, is a huge part of both burnout and depression. A major depressive disorder, it's probably it's going to be important to find a health provider who can help you, whether that's a therapist or someone who can prescribe medication, or frankly, I typically would recommend, if you're going to do medicine, that you should also have a therapist. Medication by itself often isn't sufficient. The support for burnout is probably going to be enough. It's not really a clinical condition that requires treatment, but it does need support. So that's a distinction between those two in terms of managing it. Prioritizing self-care and exercise. I mean, this is a very kind of logical approach to effective management of burnout. Address the stressor, talk to other people, especially if you feel like you can't. Like, it's one of the things I used to tell people: if you feel like you can't talk to somebody, then you must.
That makes sense.
It's really important, right? Getting exercise is really important. Taking care of yourself, eating well, making sure that you're doing those things. We've
Mm-hmm.
talked previously about having a self-care plan. When you're
Mm-hmm.
in the middle of being burned out or feeling really depressed is not the time to try to figure out what's going to make you feel better. It's really good to have that strategy ahead of time. So,
Mm-hmm.
I happen to know that taking walks does my mood good and it reduces my stress. So
Yeah.
I keep my walking shoes nearby. Um, uh, you know, um, I think sleep is important to both. I think
Mm-hmm.
the key difference here is that if you start to do these stress and burnout management tools and it's not getting better, it might be time to go see someone with the clinical experience to do an evaluation and tell you whether treatment might be helpful.
Mm-hmm.
So
Excellent.
hopefully that helps.
Yeah, definitely. All right, let's look at what how we stack up on our poll here. So it looks like that we're kind of in the middle.
Hmm.
Are
Hmm.
you surprised by that?
No,
Yeah,
no.
I agree. I agree.
Um,
Yeah.
I mean, even, I mean, most days I would have picked, not me. But if I really think about it over the long haul, I do feel overwhelmed
Mhm.
sometimes. I mean, I
Yeah.
think we all do.
Yeah.
The and that's the thing, like, if you take care of feeling overwhelmed when it happens, you're
Hmm.
much less likely to fall into burnout. If they pile
Hmm.
on top of one another, that's when it really becomes an issue.
Yeah.
So that's self-care, having a self-care plan, finding things that to address stress, having people to go to that you can talk honestly with about how you're doing. All of those things are really important.
Yeah. Agree totally. Talk us through the last piece about best practice workplace support before we get to
Yeah,
some of these questions that may cover some of the questions that came in.
sure.
Addition.
Um, and I know I've seen some questions kind of
Hmm.
pile through about how can employers help. Um,
Yeah.
First thing to do is to listen to your employees.
Yes.
It's really important to ask the question, and by asking the question, I don't mean, a one-time survey. I mean
Hmm.
having conversations with people to ask them, how are you doing? What do you need? And really listening to the answers to that, because
Hmm.
just throwing an app at at a workplace isn't by itself going to do it unless you happen to have a really young workforce that's totally into apps. That might be
Hmm.
helpful. Um,
Yeah.
but you got to find out. You have to know your workforce. I think that having a deliberately planned workplace behavioral health program is important. That means that you have a methodical approach to understanding your workplace's baseline, and
Hmm.
then um, there are a couple of components to this. One I think that's important is what we call social support trainings. So helping people get less afraid of having these conversations. Um, all of us we talk about this with mental health first aid. All of us have the experience of, we say, how you doing? And we expect people to say fine.
Hmm.
And when somebody says, not so good, we panic because we don't know
Yeah.
what to say. Well, social support trainings like mental health first aid are really designed to help people feel more comfortable saying. Um, Managers play the biggest role in this. Um, Research has shown that time and time again.
Hmm.
So getting managers comfortable with having these conversations. And by that, I don't mean, do you have a psychiatric condition? You don't have to ask that
Hmm.
question, but you do have to ask and mean it. How are you doing? And what do you
Yeah.
need? Right?
Yeah.
Um,
Very true.
having someone who can help you think through what's going to work in your workplace, I think, is an important component of this. Um, that's why we built what we built in Tempo
Yeah.
Live, and there are other approaches as well. That the key components, I think, are get a baseline and understand it, build a culture in which it's okay to start having those conversations, and then follow that up with measurement. And it's really, I cannot overemphasize that every single health intervention, whether it's physical health or emotional health, when it's driven from the executive level down, works way better than not. The C-suite has to get that. You have to mean it, right? I think that's really, really important.
Absolutely. The other piece about PTO that we've talked about before, about, using your PTO, you've also brought up really good points about, that it's not just an issue of, having employees take PTO, but it's that they then don't have to take on the responsibility of working a whole lot before that, or, coming back to a mess. When they come back, it's like, if you have that going on, then, really what is the value in taking time away? Yeah.
I learned that. I said, when I manage teams, I mean, one of the things that I learned was I need to build into my staffing model. I need to build PTO into my staffing model, because otherwise, if I have a barely adequate staffing model, what happens is that before the week that I take off to rest, I work twice as hard, and I work twice as hard when I get back.
Yep.
Well, we've all had the experience of coming back from PTO and being overwhelmed. And it's like, 5 minutes into being back, it didn't work. Well, part of that is how we do staffing around PTO, and making sure that, we really let people unplug. It's even bigger than that. Take time away from work that's away from work. Like managers, for heaven's sake, don't send emails at 11:30 at night. Right? Because that sends a message. It sends a message that you're overworking, and it implies that you want other people to overwork. Not a good idea.
Very good points. Very good points. All right. We have lots of good questions that are here. So we'll kind of rapid fire here. We'll make responses if we can kind of abbreviate some of the responses there. One said, what is the key to finding balance between your career, caring for aging parents, and being the custodial parent of a teenage grandchild with behavioral health difficulties? And how do we keep from burning out on life? You got your hands full. Yeah.
Yeah. I mean, the place, again, this sounds overly simplistic, but the first place to start is make sure that you have some kind of support. Make sure that you're having some kind of conversation with somebody, to get whatever help you can get. Caregivers need breaks. None of us are capable. When I was helping to care for my elderly parents, I couldn't do that 24 hours a day. My wife couldn't do it 24 hours a day. People need breaks. And you have to set priorities. And the truth is that, families are always the priority. That's just the way that it is. It's tough. I mean, I don't have an easy answer for that. It's all of these things, but it's mostly having support and having somebody to help you think through, well, what can I do to take care of myself? And I feel for whoever wrote that question. It's tough.
Yes, absolutely. How do you best support someone that you observe as being in depression, but maybe just acts out in an irritable response?
I guess it probably depends on what your relationship with that person is. But a couple of general principles are, ask that person if you can buy them a cup of coffee.
Ooh, I like that.
Or get them a cup of tea, and
Mhm.
can we go sit and talk for a minute? So get people by
Yeah,
themselves, and then
yeah.
make your observation.
Hmm.
Listen,
Hmm.
you seem really irritable all the time, and I feel like you're biting my head off, but I'm really wondering if there's something else going on here, and I want to be able to help you with that if I can. I think we have to own our observations
Hmm.
in a way that's not threatening. Um,
Good points.
and some people are
Hmm.
just grumpy and they're crabby and they might not be depressed, right? Um,
Yeah,
I mean, that does happen. But
yeah,
if we see someone that we're really worried about in that way, I think owning, here's what I see and here's what I am wondering.
yeah, yeah.
Most of us respond pretty well to that question.
Yeah. We had one that was just a comment that said there's some similarities between being lonely and actually being alone. And I agree with that. Yeah, there are some
Hmm.
similarities.
Yeah.
Let's see. One was asking, are you saying that listening to music while working is multitasking? And she mentioned that her ADHD son works much better when he has music on because it drowns out distractions. I think that makes a lot
Hmm.
of sense. Yeah,
Yeah.
yeah.
Yeah. Well, and that's so um, attention is a bunch of different things, and attention deficit
Mm-hmm.
can be a bunch of different things. If the main issue is distraction, is other things being distracted, then having
Mm-hmm.
a having white noise, having music, um, uh, preferably music with that doesn't emphasize lyrics,
Mm-hmm.
um, it can be really helpful. If
Yeah,
the
yeah.
kind of attentional problem is I'm having trouble like focusing on one thing, it's not the
Mm-hmm.
distractions, it's just I can't keep my mind focused.
Mm-hmm.
Music can actually become a distraction because your brain goes back and forth between the music and what you're trying to do. So
Yeah,
sometimes,
yeah.
different things work for different people.
Mm-hmm. Mm-hmm.
Really, really important. So
Yeah,
yes, I don't mean to say that it's terrible if you listen to music while you're working. Um,
yeah, yeah, for sure. Yeah. Let's see. We have another one. In my short 5-year marriage, my husband had 3 broken leg incidents, a stroke, vertigo, lung cancer. Both of our fathers have died, and both have found new jobs. And my teenage son is struggling with ADHD and depression. My question is, when do you seek help when you're burned out from being everyone's support person? Yeah.
as soon as you notice that you're burned out from, or you're at risk of burning out from being everyone's support person, um,
Yeah.
here's the key for me. The minute that I begin to feel like I can't take a break because everyone's depending on me is the
Mm-hmm.
minute that I need to take a break.
Mm-hmm. Mm-hmm.
Um,
Yeah.
because the truth of the matter is that me taking care of myself for 15 minutes is actually going to make me more able to take care of other people.
Mm-hmm.
Um, and same thing with getting support. Like, I need the support so that I can take care of other people. And often I think we get ourselves, those of us who are caretakers,
Mm-hmm.
you know, I'll raise my hand.
Yeah.
Um, the we often think that we have to take care of other people because everything will fall apart without us. That's a really serious warning sign of getting burned out, of being at risk for getting burned out, because it's
Yeah.
not realistically true. The world
Mm-hmm.
won't end. We don't believe that. We're convinced that it's not that it'll fall apart, but it probably won't.
Yeah. Yeah.
Um,
Well, Dr. Les, we are at time here. I know that we still have a few more that are remaining. Maybe we can follow up individually and get
sure,
some additional answers because there's some good things that were on here, especially about introverts, extroverts, and identifying some of those support people, et cetera, long-term
sure.
implications. So we'll go ahead and wrap here. But again, guys, Thank you so much. Thank you for prioritizing this. Thank you for caring enough to be open with us and honest with us and ask the questions so that we can all learn together. It's making a difference. You're making a difference in the world. So I appreciate you so much. Again, if you'll, the 3 things that we had mentioned at the very beginning, if you'll click that register now button at the top of your screen, I think that we'll pick up a lot of these concepts in the next webinar where we talk about some of the quiet quitting and cultures and things of that sort. So thank you, Dr. Les, and thank you all of you, and have a great afternoon.
Thanks,
Bye-bye.
everyone. Thank you so much.